Welcome to more of Oncology.TV coverage from ONS 2010. And now talking about hematological malignancies and the elderly, we're pleased to have Sandy Kurtin, nurse practitioner from the Arizona Cancer Center at the University of Arizona in our great state of Arizona.
Yes.
Thanks for being with us.
Thanks for having me.
Okay, do you feel older patients are offered different treatment options just based solely upon their age?
I do think they are offered different options based on their age in many cases. I think we're getting better at that, but historically, age has been excluded in all clinical trials. We really don't understand a lot of the physiology and unique needs of the older patient. And people are sometimes just simply afraid to treat them as aggressively as they would younger patients.
In all fairness, it's kind of hard to ignore an 80-year-old cancer patient and think about frailties and things of that nature.
That's true, although we know that the life expectancy now for people of that age is really still pretty good. When you look at actuary tables, the life expectancy of somebody that's 65 is up to 17, 18 years. So even at the age of 80, people can be expected to live as much as 10 to 12 years. And if they have a disease where the life expectancy is 1 or 2 years, then it is really appropriate to offer them some type of therapy.
What are some of the important considerations when evaluating older patients with hematological malignancies?
Well, I think that's a good question. Beyond just the age itself, there are many things that are currently being looked at. Some of those include physiological changes such as renal function, bone marrow function, underlying heart disease, and those kinds of things. And there are many studies recently looking at the concept of comorbidity and performance status, just being able to do the things you would do normally every day, getting dressed, taking a bath, eating, those kinds of things.
Can you describe some successful strategies for managing your elderly patients during cancer treatment?
Well, I think as we go forward, we're going to see things adapted. So there are studies now looking at modifying therapies so that they are still aggressive enough but adapted to allow more effective treatment of the older patient. So for instance, in multiple myeloma, they've found that giving a drug called bortezomib once weekly can be just as beneficial for the older patient and far less toxic and dose limiting. Similarly, in non-Hodgkin's lymphomas, diffuse large B-cell non-Hodgkin's lymphoma specifically, we know that offering patients drugs, anthracyclines for instance, is very important for their therapy, but we have to take a careful look at their underlying heart function and such. As a nurse, I think it's very important to look at their support system. Do they have available caregivers? Can they drive at night in the dark? What kinds of things are we asking them to do? How often do they need to come to the clinic and things like that? Are they able to take their own medications? There are many things.
And really, of course, this is an area of growing importance as the life expectancy today will likely be increased in a couple of years from now.
Absolutely. The estimates now are that in the year 2030, 85% of the population will be over the age of 65. So it's going to become very much a part of what all of us do in this field.
Sandy Kurtin from the Arizona Cancer Center, thanks for joining us here at ONS.
Thank you for having me.
Go Sun Devils.
No, go Cats.